Hello, my name's Dr. Richard Shaffer. I'm a consultant radiotherapy specialist. I use radiotherapy to treat people particularly with non-cancer conditions, also called benign conditions. These include conditions such as osteoarthritis, tendonitis and Dupuytren's disease. Radiotherapy is the use of X-rays, radiation, to treat various conditions. We use it in very high doses to treat people with cancer, because cancer is something that grows uncontrollably and radiotherapy is really good at stopping things growing. We can use it in lower doses to treat benign conditions that are overgrowing, around half the dose that we use to treat cancer. But there's also a use of radiotherapy in very low doses, around 1/10 to 1/20th of the dose that we use to treat cancer, to treat inflammatory and degenerative conditions, because it's got a pain-relieving effect and an anti-inflammatory effect. If you've already tried painkillers and stretching and exercises and so on, and it's just not working, then very low dose radiotherapy is a safe and effective treatment to get rid of the pain and getting you back to what you normally do. The first thing is that I'll send you a questionnaire and I'll ask you details about yourself and also about your condition and any previous treatments. When I see you in clinic, I'll ask you further questions and also examine you. If you have a condition that is eligible for radiotherapy and where radiotherapy is likely to be successful, and you decide you want to go ahead with the treatment, I'll get you to sign a consent form. We'll then arrange a CT scan. This is not to look for anything new, but it's just really so we can direct the radiotherapy in the right direction. There's normally a week or two between the CT scan and starting your treatment. When you actually have your treatment, you'll come to the radiotherapy centre, you'll be lying down. It's painless treatment, so it takes roughly 10 minutes a day. Each day when you come for treatment, the appointment time will be 10 minutes. You lie yourself down on the couch, the machine will be on for roughly a minute or two, and then you get off the couch. We'll treat you 6 times, and that will be over 2 to 3 weeks. So you might be treated twice a week or 3 times a week, but each treatment is 10 minutes per day. Low-dose radiotherapy is a very safe, non-invasive treatment. I wouldn't really expect it to give you any side effects at all. In particular, it doesn't make you feel drowsy or dizzy, it doesn't hurt, there's no injections, you won't lose your hair, you won't feel sick. I wouldn't really expect anything at all, although sometimes people do get a slight irritation of the skin in the area that we treat. I'll need to see you face to face in clinic, and I go to London, Guildford and Nottingham. I can see you in any of those 3 centres. But in terms of the treatment itself, we've got 14 centres around the UK, and so you can have your treatment locally to you.